Hello, I'm Steve Prinz. I'm a psychiatrist in the DuPage, Illinois area. My specialty in psychiatry has been working with eating disorder patients, uh, mood and anxiety patients, and patients with trauma. I have been a psychiatrist for 35 plus years. I have worked with some very talented psychiatrists who have given me some wonderful training in the area of working with eating disorder patients. One of my colleagues of the book that we're writing has also started working with eating disorder clients. I've been a national speaker on the topic of eating disorders. I belong to several organizations that support and promote wellness, including an organization called Anorexia Nervosa and Associated Disorders of Eating, ANID, as well as IADEPT. And I've been medical director for several different hospital programs with a focus on eating disorders, as well as mood and anxiety disorders. And today, what I'd like to do is share with you some medical kind of concerns, complications that could occur with behaviors of starvation, with behaviors of binge purging, and with behaviors of compulsive overeating. This is going to be a part of the book that I am co-authoring with the Dr. Maria Rago and a recovered patient, Erica Brownshausen. So let's look at really what goes on with the body in starvation. And I think what we need to understand is some common concepts with our body. So much of our body's physiology is connected to a part of our brain called the hypothalamus. The hypothalamus is a regulatory part of our brain. It controls our hormones, it controls our body temperature, it controls our metabolism, and so it's a very essential part of how our body works, this brain-body connection. When we look at starvation, one of the things that happens is that we have a change in our blood pressure. So let's try and understand what blood pressure really involves. Blood pressure involves the heart contracting, and when the left ventricle, which is the bottom left part of the heart, when it fills up with blood from the left atrium, the upper left chamber of the heart, when the left ventricle contracts, it pushes open what we call an aortic valve. This is a valve that goes into our main arterial system. And when the ventricle contracts and pushes open the aortic valve so that oxygenated blood could go throughout the body, that's what we call systolic blood pressure. When that valve closes, when enough blood goes through the aorta and the valve closes so the heart could fill up again, that pressure in the heart when the valve closes is called diastolic blood pressure. So when we look at blood pressure, your doctor may say, oh, your blood pressure is 120/80. What that means is that you have a pressure that opens up the aortic valve, and that's the 120 mark. And then when the valve closes, that pressure, the 80, is the diastolic mark. So what happens with all of us, and then what happens with starvation with blood pressure? So for all of us, when we are in a sitting position and we take our blood pressure, we get a basic reading. And when we stand up, what happens is that the blood in our veins, the veins bring blood to the heart. When the blood in the veins what happens when we stand up is that blood pulls down to gravity. Right? So if I had a glass of water and I poured it out, the water would hit the floor because gravity is pushing the water to the floor. The same thing happens when we stand up from a sitting position. The blood pulls down in our veins temporarily because of gravity. What's really neat is that the veins have these little shelves, and these shelves jut out so that the blood can't continue to pull down to gravity. Otherwise, if we didn't have these shelves, we'd have blood pulling in our ankles. We'd never get blood back to the heart, and we'd never get then oxygen to our brain, and we'd all be fainting. So for all of us, when we go from a sitting to standing position, temporarily our blood pulls down to gravity, the shelves jut out, and so when the heart contracts after we stand up, there's not as much blood in the heart. So when the heart contracts to open up the aortic valve, our systolic blood pressure is going to be lower because there's less blood in the heart, so there's less pressure opening up the aortic valve. The analogy I would give is that if you had a water balloon and you filled it up completely with water and you let it go, the force of the water coming out of the balloon will be stronger with the more water you have in the balloon, right? If you had a smaller balloon, it's going to come out with less force. If you have a larger balloon with water, it's going to come out with more force. The same thing with the left ventricle that contracts and pushes open the aortic valve. The larger amount of blood we have in the left ventricle, it's going to push that valve open with more force. So when we stand up, there's less blood that temporarily goes to the heart from the veins, and the initial force of opening up the aortic valve when the ventricle contracts is going to be smaller. So for all of us, our systolic blood pressure is going to drop, and our diastolic blood pressure may drop a little bit too, because when the blood lets out of the aorta and the aortic valve closed, there's usually less blood in the heart, and so the diastolic blood pressure would be lower as well. So let's take someone that's starved and dehydrated. So now this person has less volume of blood to begin with. So when their heart contracts, when the left ventricle contracts to push open the aortic valve, because you have less volume, you're dehydrated, the systolic blood pressure is going to be smaller, right? Just like a smaller balloon with water. If there's less water in that balloon, it's not going to come out as strongly as with much force as if you had a larger volume of water in the balloon. What's more significant though is that when someone's dehydrated and they stand up, there's even less blood that goes to the heart, because when the dehydrated person stands up, the blood pulls down, the veins jut out their shelves, blood is going to the heart at a slower rate, and the blood pressure now, the heart contracting, is going to have less blood, so we're going to have a lower diastolic blood pressure. Less blood, less force opening up the aortic valve. If the blood pressure drops more than 20 points, it's often a sign of dehydration. So often the person that starved themselves and is not taking enough fluid, they often have their blood pressure drop 20 points or more, and that could cause lightheadedness, dizziness. We're not getting as much blood out the aorta into the arterial system. The arterial system goes throughout the body, including the brain, through our carotid arteries, and we have vertebral arteries that go along the spinal cord. And if we get less blood going to the brain feels lightheaded and dizzy. The hypothalamus senses this, and we get a little bit lightheaded and dizzy. That's what we call orthostatic hypotension. tension. This occurs often with dehydration. What else happens to the heart in a severe state of starvation, or if we don't get in enough fluid, if we're dehydrated? Well, if we get less blood going to the heart says, hey, there's not enough blood coming into me, so the heart will compensate by saying we have to beat more rapidly. So for all of us that are not dehydrated, when we go from a sitting to standing position and less blood goes to the heart because blood pulls down to gravity temporarily, even though the veins jut out their shelves, we're still getting a little less blood to the heart right away. The heart senses that there's less volume going to it, so the brain, the hypothalamus, sends a message to the heart and says, beat more rapidly. So now the heart's going to beat at a more rapid rate in order to compensate for the decreased volume of blood that's going to the heart. If the heart rate increases more than 20 beats per minute, we say that's orthostatic pulse. So when we do a sitting blood pressure and pulse, and then we have someone stand up, if their pulse rate goes more than 20 beats per minute, that's called orthostasis as well. And this happens more with starvation. And this could cause someone to feel lightheaded and dizzy. So what else could happen in acute starvation? In general, the hypothalamus senses what the body needs. And if someone's not getting in enough nutrition, what often will happen is the hypothalamus says, let's preserve energy. If we're not getting in nutrition for energy, how could we keep our body functioning as well as we can by preserving energy? So one thing that happens is that the hypothalamus tells the heart not to beat as quickly, right? If the heart is beating rapidly or quickly, it uses more energy. So the hypothalamus says to the heart, slow down your contractions, let's preserve energy. So this is why we often see someone with significant starvation having a baseline low heart rate. And that's good because the body with the brain is working together to slow down energy expenditure. However, this could also lead to some concerns. If the heart rate goes below 40 beats per minute, there's a greater chance of an abnormal rhythm of the heart, and this could be dangerous. So normally what happens with the heart, when a doctor listens to your heart, a doctor puts a stethoscope on the heart, on the chest, and usually we hear a lub-dub sound. And the lub sound represents the top part of the heart, the atrium, contracting, pushing blood into the bottom part of the heart, the ventricle, contracting. And so what the doctor's listening to is atrium contracting. And let's look at the left side. There's 4 chambers of the heart. There's 2 atrium, 2 upper chambers, a left and a right, and there's 2 lower chambers, a left and a right. What we're listening is a lub is when the upper chamber of the heart contracts, and let's look at the left side because it's the side that's going to cause more medical concerns. When the upper chamber of the heart contracts, the atrium, you hear lub. It pushes blood. It opens up what we call a mitral valve, a valve that separates the atrium and the ventricle on the left side. It pushes blood and puts pressure on this mitral valve, which then opens up so blood could come into the left ventricle, the lower chamber of the heart on the left side. And when blood fills up in the left lower chamber, it then contracts and pushes blood out the aorta. That's the dub noise. So if heart rate goes below 40 beats per minute, a lot of times we don't get that lub-dub, lub-dub. Sometimes what could happen is the left atrium could contract on its own, and the left ventricle could contract on its own. So instead of getting a lub-dub, lub-dub, we may get a lub-dub, lub-dub, dub-dub, lub. Both chambers are contracting on its own. This is a significant concern that could cause medical concerns, which we'll talk about now. So if blood is not moving consistently, blood could clot, right? So think about if you're shaving, whether it's your legs or if a male shaves his face, and let's say you nick your skin and you start to bleed, what often happens is the blood will clot, which is great because otherwise we'd be bleeding to death. Hemophiliacs have a condition where their blood does not clot. That's why they have to be super careful when they cut themselves or if they bruise themselves, because they can't stop the bleeding. So if blood is not moving consistently, it will clot. Another example of this is if you take a plane ride overseas and you're sitting in the same position for 8 to 10 hours, you're at a greater risk, if you're not getting up, stretching your legs, moving around, for blood to settle in your veins in the calf muscles, and sometimes you could get a blood clot in your calf muscles, and that could be very dangerous. There have been reports of people actually dying from these long plane rides because they develop a blood clot. The blood clot then goes to the heart then pushes it out the aorta, and once it's in the arterial system brings oxygen and nutrients throughout the body. Once it's in the arterial system, it could cause a blockage anywhere in the arterial system. If you get a blockage in your carotid arteries, the arteries that go through the neck into the brain, or your vertebral arteries, the arteries that go along the spinal cord to the brain, you could actually die from that blood clot. Or if the blood clot goes to the lungs, it could prevent the lungs from working appropriately. So if the heart rate is below 40 beats per minute and we're getting not a set pump working, lub-dub, pushing blood forward all the time, if we get a lub-dub, 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 lub-lub, what happens is that some of the blood gets stuck in the heart. It's not pushing forward smoothly the way it should. And then this blood could clot, and these clots could go out the left ventricle into the arterial system, and they could cause a blood clot into the arterial system. Again, the worry is that if they go into the carotid arteries, the arteries in the neck, or the vertebral arteries, the arteries along the spinal cord into the brain, they could cause someone to die. Wherever they lodge, the tissue that's above where the clot is, doesn't get oxygen or nutrients and dies. So this is the concern, even though the body, again, does a phenomenal job with the brain by saying, let's preserve energy if we're not eating appropriately. The risk is that we could get a heart rate very low that could really cause concerns with throwing a blood clot. So that's another concern with significant starvation and significant dehydration that could occur with a person. The other big concern in starvation is that our ability to store glucose in our liver through what we call glycogen is not working as well. And our glycogen, these stores of glucose, start to diminish. We know that the body and brain needs glucose. The brain functions greatly on glucose as energy. And so now we're depleting our stores of glucose, but what's also significant is that our ability in the liver to make glucose, to convert to glucose through glucogenesis, making of glucose, is also inhibited. And what that really means is that we're short of glucose, and glucose is so important for our body and brain. In fact, one of the risk factors for significant medical concerns and potentially death from starvation is if glucose levels continue to remain very low, if glucose levels are below 60. So those are some of the immediate concerns with starvation. If we have starvation for longer periods of time, there's also medical concerns. And one of the things I want to talk about actually with starvation that could occur early on in starvation, but at any phase of starvation, is something called refeeding syndrome, which we have to be cautious about. Refeeding syndrome refers to when we refeed the starved body, there could be significant medical concerns if we don't refeed the starved body appropriately. So let me just talk a little bit about refeeding syndrome. So it's sort of an interesting concept. This was first sort of understood by us in what we call a Minnesota experiment study, or another term for that is the KEYS study. And this was a study that was done in the 1940s by our government, by the United States government. They looked at conscientious objectors to World War II, and these conscientious objectors were able to participate in the study, in which we were to starve these servicemen, and the goal was to at least cut their weight by a quarter of what they weigh, and so we restricted their caloric intake. And the idea was to say, let's look at what happens both psychologically and physically to a person in a starved state. One reason why this study existed was that there were concerns that in World War II, many of the European countries which had actual war battles on their soil, several of these countries may end up in a famine state because their crops would be destroyed by the war. And so we wanted to understand what could happen within this famine state. What was interesting is that many of these conscientious objectors had medical concerns. So when we started to give these conscientious objectors nutrition and fluids, many of them developed difficulty breathing, congestive heart failure. Congestive heart failure is when the blood starts to go backwards from the heart to the lungs, and we start to drown in our own fluid. And so we started to see these effects occur in the starved conscientious objector when we started to refeed the objectors. There was difficulty with focus and concentration. Often one felt physically not as well, had headaches, dizziness. There were many other medical kind of concerns. Psychologically, we saw a lot of ruminations and obsessions around food. In fact, when these conscientious objectors had an opportunity to go into a library, now think about it, these were men in the 1940s. When they went into the library, they had a focus on books with food, so cookbooks and recipes. And when they had visitors, what often would happen is family members would say, and my loved one is more irritable, they're not concentrating well, they don't seem like they want to socially interact as appropriately, they were more withdrawn an isolative, looked like they were more depressed and anxious. So what happened is when we started to refeed these conscientious objectors, we started to see more medical concerns, especially around the congestive heart failure. That was probably some of the first data we had on refeeding syndrome, even though we didn't know what we were looking at. Let's fast forward, and if you look at when our veterans in World War II, when they rescued concentration camp survivors, many of these concentration camp survivors were extremely emaciated and were in a starved state. And our soldiers did a very nice thing. They gave chocolate bars and fluids to these survivors, and unfortunately, several of the concentration camp survivors died. And they died from medical complications we didn't know at the time, but from refeeding the starved body. And so that was some data on refeeding syndrome. Then if we look at TPN, this is when we would give nutrition through our veins for medically compromised patients, patients that had cancer, patients that had chronic medical illnesses that needed nutrition but could not take in nutrition orally. So we did some tremendous things medically. We discovered that, hey, we could give nutrition through the veins and this would be a wonderful thing. And it was a wonderful thing. However, when we didn't understand how we should refeed the body, several of these starved patients did very poorly with the nutrition we gave, with giving too much fluids at one time. This was an example of refeeding concerns, refeeding syndrome. With starvation, we see the same thing. When someone's not eating enough to sustain their body and we start to refeed, we could run into medical concerns. So what happens? Why does this even occur? In starvation, what happens is our tissue, muscles, bones, our nervous tissue starts to atrophy, to actually, the muscles start to shrink, the bones start to demineralize, our brain starts to shrink in severe starvation, especially if starvation occurs over time. And so when you think about it, in starvation, our heart muscle shrinks. So our heart muscle is weak. Just like our other muscles in our arms and legs become weak as well. And so think about the heart being stressed and weak, and now we're pushing fluids and nutrition. When we push nutrition, what happens is that we signal the pancreas, that's an organ that produces insulin, and especially like our soldiers, if we give like chocolates and we surge insulin. So if we give nutrition, often our pancreas produces more insulin. So this is a good thing in many ways because the insulin will take oxygen, nutrients, sugar, and bring it into the red blood cell. The red blood cell are little like transporter devices. They're like little trucks that carry nutrients. And so we're getting glucose into these little transporters into our red blood cells. And it sounds good, right? Because the red blood cells now will deliver the glucose to our body. But what also happens is that the insulin causes phosphorus, which is a positively charged ion or particle in our blood, to go into the red blood cell. And that's not that good because we want phosphorus circulating all over the blood outside of the red blood cell. The phosphorus will go into muscle when it's outside of the red blood cell. So why is that important? That what does phosphorus even do? I don't know if you guys remember in high school taking some science classes, and you learned the Krebs cycle, and you learned about high phosphorus bonds, these triple bonds. And if you break these bonds, these chemical bonds, you release a surge of energy. And so we need phosphorus for energy. If we don't have phosphorus, our tissue that requires a lot of energy doesn't function as well. So let's go back for a second. So we have this starved body. We're giving nutrition. The nutrition triggers the pancreas to release insulin. Insulin brings sugar into the red blood cell, which is good, but it also brings phosphorus into the red blood cell, which is bad. And we have a weakened heart already. The heart needs phosphorus to contract, to beat. And now we're also giving fluids. So the fluids are building up in the body. The heart can't handle the increase in fluids because it's not functioning well. It's not beating appropriately. It's weakened. It doesn't beat with as much force because it doesn't have phosphorus. And so this leads to blood going backwards from the heart into the lungs. And that causes what we call congestive heart failure. You can't breathe as well. The heart and lungs don't function as well. You don't get as much oxygen to the heart so that the heart can push it out through the arterial system. This is one of the biggest concerns with refeeding syndrome, is congestive heart failure. And again, we've seen this in history happening, but now we could understand it better. Other tissue that needs phosphorus, though, is our diaphragm. Our diaphragm, that's the muscle that helps us breathe, pushes our lungs up and down. The diaphragm now becomes very weak because it doesn't have enough phosphorus. It doesn't have the energy to work well. So it's harder for this person to start to breathe. Our brain needs phosphorus, so our brain is not functioning as well. Our red blood cells need phosphorus, so they're not working as well. So the danger really with refeeding syndrome is that we have to monitor phosphorus very closely, and often we have to give phosphorus supplements to help the body work effectively. So that's refeeding syndrome. And again, that could occur both in acute starvation, in any phase of starvation as well. And there's all these criteria on what we should do to make sure that the heart is functioning appropriately. We do lots of blood tests on the starved person. So let's talk about some other things that could occur with starvation. So as we starve longer and longer, there's other medical concerns that could occur. So often a woman may lose their menses. A man in longer starvation often does not produce as much testosterone. The testes actually shrink in size and we don't produce as much testosterone. So what are the risks of not producing enough testosterone? What are the risks of not producing enough female hormone, of not producing enough estrogen? So we know to keep our bones strong, we have to have hormones, both for females estrogen, for males testosterone, to take minerals from nutrition that gets circulating through our blood, and to bring these minerals into the bone to make the bone healthy and strong. If we don't have enough of these hormones, what happens is, instead of the bone getting strong, the bone actually starts to demineralize and the bone becomes weak. If you've ever looked at a tree that has been cut down and you see the circles in the tree, and let's say there's weather, storms, termites, sometimes you could see like little chips away in the rings of the tree. think about the tree like our bone. Our bone is very dense material, but if we don't get minerals consistently being placed into the bone, which we need female and male hormones to do, the bone starts to demineralize, and like that tree, the inner parts of the bone start to show cracks and holes, and so then the bone can't function as well. Our bones are used for lots of different things. One of the things they're used for is our motion and our movement. We think about muscles, but really the muscles often to move have to connect through tendons, ligaments to the bone, and the muscles will pull on these ligaments, tendons, and will then use the bone as sort of a solid structure to move around, to bend. And so often what we see is that the bone becomes weak in starvation, and so when the muscles start to put pressure on the bone by pulling on the bone through the tendons and ligaments, what happens is the bone can't handle the pressure and we get little cracks in the bone, and those are called stress fractures. So that's a concern with somebody that is engaging in more significant starvation. I often will ask this question, who do you think has a greater chance of bone loss, males or females with starvation? And there's something called osteopenia, that's like more mild bone loss, and then there's osteoporosis, which is more significant bone loss. But believe it or not, even though everyone thinks females are at greater risk for bone loss, it's really males. And so males often, we forget about this. What we really should be doing is doing DEXA scans or bone density scans with someone that has more significant starvation, to get a baseline and to follow how the bones are working. So that's a concern with starvation. One of the things that happens is that all of our tissue in starvation starts to shrink and starts to atrophy. So what happens is even our fat in our fat cells starts to decrease. Not the number of fat cells, those stay the same, but the actual fat content in the fat cells. So in a female body, the largest amount of fat cells per tissue is the human breast. And so what will happen is that the fat in the fat cells start to shrink, so a woman could lose bust size. But why is that significant medically? It's significant medically because fat stores estrogen. And so when you lose fat in the fat cells, you're losing your estrogen, and you have a much greater chance of having disruption of your menstrual cycle, and that could hurt your bones. So the other thing psychologically, sort of going off tangent here, but this causes many concerns about really related to trauma with one's starvation. If someone starts to refeed and their bust size gets larger, if someone was sexually traumatized, that could cause issues around their sexuality, which we'll discuss in the book in much more detail. So the other thing that happens, which I think is really fascinating, is that we start to get what we call lanugo here with more significant starvation. So if anyone has picked up a newborn and they look at their baby or a baby, you could see that there's peach fuzz all over the baby's body. And this peach fuzz, it's like fine little blonde hair. The belief is that the baby is born, so to speak, with a fur coat to keep body temperature functioning appropriately. when the baby's born, what the doctor often does is gives the baby to mom. Mom holds the baby, bonds with baby. Then they grab the baby, they wrap the baby up in a towel, put a hood, a hat on the baby, and put the baby in a warm incubator to keep the baby warm, because the baby loses temperature very rapidly. The baby's head is larger in proportion to the body, and a lot of heat energy comes out of the skin. And so we're trying to preserve heat energy. So the belief is that the baby is born with peach fuzz, and this peach fuzz is supposed to help keep the baby warm. What happens with significant starvation over time? Guess what? We develop lanugo hair. We get this fine hair throughout our body, and our chest, and our back, and our stomach, and our arms, and our face. And the belief is that this is the body's way of trying to help the body preserve energy. One of the things I forgot to mention with starvation, often early starvation, but could occur any phase of starvation as well, is that the hypothalamus, that part of the brain that controls all our regulatory system, will control our body temperature as well. So the hypothalamus, when we're starving, says, hey, we have to preserve heat energy. We have to preserve energy in the body. So we talked about it slowing the heart rate down, but what it also does is the hypothalamus sends little messages to our blood vessels called capillaries. These are blood vessels in our skin, and these blood vessels in our skin help regulate body temperature. So think about it. If you're exercising very strongly, or if you have an infection and you start to have your immune system working very hard, often we start to elevate our body temperature. And then all of a sudden, after we exercise, we sweat more profusely, or after we have an infection and we break the infection, we start to sweat, our fever goes down and we sweat. What is really happening? The hypothalamus says there's too much heat energy in the body, and the organs have to function at a core temperature. If we develop too much heat energy, then we have to get rid of that heat energy. A dog may get rid of that heat energy by panting, but what we do is we sweat. So if we have too much heat energy, we open up our little capillaries. The brain says, open up those little blood vessels so that water could come out as sweat, and that releases heat energy. What happens if we're starving ourselves? Just the opposite. The hypothalamus says, hey, we have to preserve energy. We have to preserve heat energy. We have to make sure that our inner organs, our liver, our kidney, our heart, our pancreas, stays at an appropriate temperature. So the hypothalamus sends messages to the capillaries, these little blood vessels in the skin, and says, capillaries, close. We gotta keep the heat in our larger blood vessels, so don't get rid of the heat through sweat. That's why in starvation, if anyone's ever would shake someone's hands or look at one's fingers, often they feel cold or they have a blue tinge. And that's because these capillaries are staying shut. The other thing that I didn't mention also in starvation at any phase, but is that the hormones that the hypothalamus is responsible for controlling, the hypothalamus sends messages to the pituitary gland, which is really our gland that makes all these hormones. But the hypothalamus in starvation state says to the pituitary gland, be careful with the hormones you're releasing so that we don't use energy. So the hypothalamus tells the pituitary gland says to the thyroid gland, the gland in the neck, slow down. The thyroid gland produces hormones that help with metabolism, help with energy. But the hypothalamus and pituitary gland in starvation states tell the thyroid gland not to make as much hormone, to slow down in making hormone, because we want to preserve energy again. We don't want our metabolism to be as rapid. And so that will happen as well. So we could actually have a clinical state called hypothyroidism. The other thing that is really significantly affected in starvation is our GI system. So normally when we eat, we get food that starts to be broken down in our mouth, and some enzymes start to be released. The food goes down our esophagus and goes into our stomach. Stomach has acid, starts breaking down the food further, puts pressure on the very bottom of the stomach. There's a band of muscle tissue between the stomach and the small intestine that's called the pyloric area, and it's sort of like just lots of tight muscle fibers in this area that stay close. So if you think of like rubber bands tightly wound, and that separates the stomach from the small intestine. So what happens normally is when food starts to go in the stomach and pushes pressure at the very bottom of the stomach, this pyloric sphincter opens up and will allow food to go from the stomach to the small intestine. When we're in starvation states, our muscles again atrophy or start to deteriorate. The stomach's a muscle. The small intestine has what we call these longitudinal muscles. It's like the small intestine, if you think about it as a tube, and there's muscles that run along the tube. These muscles start to weaken as well. So one thing that happens is that food can't move as quickly as it normally would, but food doesn't move as quickly in starvation from the stomach to the small intestine. That sphincter separating the stomach from the small intestine, this band of muscle tissue, doesn't function as well, and food gets stuck in the stomach. And then when food does go through the pyloric sphincter to the small intestine, these longitudinal muscles that go along the tube start to atrophy. We need these longitudinal muscles to work. So normally the way we push food down the intestine is that the intestine gets the food from the stomach, it expands, and these longitudinal muscles start to expand, and then they contract, and that causes what we call peristalsis, or movement of the food down the small intestine to the large intestine. If these muscles atrophy or get weak, food doesn't move as quickly, and food gets stuck in the stomach and the small intestine. That's why if someone's in a starved state, often someone will say, I just can't eat anymore. I feel so full. And so we have some remedies for that. There's some medications we could give. One is called Reglan, which we'll talk about in another part of the book. But some of these medications could help with the abdominal bloating so someone doesn't feel as bloated